We are more than excited to have you all here at the launch of ACoDD. We have representatives from WHO, the Africa Regional Office, the Uganda Country Office, and the Global Outbreak Alert and Response Network going. We also have representatives from the US CDC, the Africa CDC, and the CDC Country Office here.
We look forward to working closely with all our partners towards achieving the goals of this initiative. And using the words of President Barack Obama, we must come together to prevent and detect and fight every kind of biological danger, whether it is a pandemic like H1N1, a terrorist threat, or a treatable disease.
Our whole network can benefit from the knowledge and experience gained by your graduates. It is the goal of AFENET to use TefiConnect as a foundation upon which to create an alumni program to facilitate this global exchange. Additionally, AFENET is planning to continue to develop TefiConnect as a tool to facilitate the mobilization of qualified FETP graduates to respond to outbreaks. To achieve this, we would like to work with AFENET to explore ways of linking TefiConnect with the efforts of the ACoDD to achieve the TefiConnect vision shared by AFENET that all people are protected by a field epidemiology workforce capable of detecting and responding to health threats. Thank you.
I look out in the crowd and I see many new faces. This tells me that this program is a success, it's successful. Because if it weren't, there wouldn't be many people here. Let me just go back a few years and say, because this program has been so successful, if it weren't for it, Ebola would still be in West Africa.
In today's interconnected world, no nation can do things all by themselves. I actually did some research on Google and found that Superman cannot exist logically, mathematically, and scientifically.
And what we see as Africa CDC's role in supporting your efforts in that is to create and enhance and support opportunities for you to integrate into national efforts to prepare for and plan for and to respond to public health emergencies. We also see it's our role to help create opportunities and support a wide variety of training, not only for public health preparedness and response, but also in other ways where we can help to strengthen your professional and technical capacities at all levels.
These are partners. We work hand in glove, and we're going to seek more, especially the organized private sector, to make this happen. In Nigeria, the organized private sector during the Ebola outbreak were running all over the place looking for us, asking us, what can we do for you? Do you want an ambulance? Do you want money? Do you want hospitals? They were very available. We had never given them the chance. We are now formed a platform to give them a chance to be partners in protecting the economy, in protecting the masses. Outbreaks and public health emergencies are not just health problems. They have high-level economic impact. The World Bank said that the investment they made in West Africa was wiped out by one Ebola outbreak. And I don't want to mention the amount they estimated. So we need to engage our private sector. They are willing partners. They have a stake. And we're going to give them this, make them bring their stake to bear. And we will all be happy for it. Thank you very much.
This launch of AFENET's Corps of Disease Detectors underscores the recognition of a crucial role that effective response to public health emergencies plays to reduce impact of emergencies, including avoidable loss of lives and decreased morbidities.
I have no doubt that the establishment of ACoDD Task Force is a significant milestone that will enable African continent to effectively respond to emerging and re-emerging public health emergencies in this vulnerable region. The ACoDD Task Force has been built on a firm platform of the Field Epidemiology Laboratory Training Program, residents and graduates. It's now my honor and pleasure to launch the AFENET ACoDD formally and wish you a productive deliberation in the coming 2 days.
So, we have stopped cholera. He has stopped. What did you stop from? Stop Ebola. You stop what? Dengue. What do you stop? You stop, that's another measles. Lassa fever right here.
Professor Mufota.
Professor Mufota Chimanga, willingly volunteer without any reservation to be a member of the ACoDD team.
I solemnly commit to abide by the ideals of this professional corps
for service to humanity and society. So help me God.
Amen.
So help me God.
So help me God.
So help me God. Amen. And the caps inside the back.
O God of all creation, our help in ages past, our hope for years to come, be thou our guide, while troubles last, and our defense is sure.
Projects. If you want to share information about projects that you are currently participating in, you can do that as well. And then administering public or private groups. So, for example, if an FETP program wanted to utilize TEPI Connect to manage an alumni group, they could have administrative rights in order to invite the alumni to be a part of that group and then manage it.
Because there have been so many experiences where things were time-consuming, were difficult. So we just wanted to see if there is a way that we can address it. Following gathering of initial requirements, we sat down with colleagues from IT, and in addition with some other partners, just to make sure that what we are doing is not WHO-centric, that we are addressing the needs of our partners and the member states.
Why is hand hygiene important? I like telling people why it's important because I believe that when people know the reason why something is important, they are likely to do it and they're likely to comply.